Good afternoon, everyone. This afternoon, we're here to deal with neurotic behavior and neuroticism, and the subject, mental and emotional health. All right? And now, I was just sitting there, and then Brother Ryan came to me and asked me if I have PowerPoint. I said, well, I have a PowerPoint, but I didn't prepare it to show. And then when he took his flash drive and went back inside, and I looked at my tablet, my phone, the laptop, the battery was gone. And it was going, but I didn't have the charger. I left the charger home. So it's a good thing that he came to me. I wasn't planning to. Anyhow, then I immediately put it on my phone so that I can have access to it both ways. So you see, technology comes in handy. All right. Now, a very important subject, and I really need you to listen well, because it's an area that people need help in. There are many people who are neurotic and they do not know. And I'm going to be describing neuroticism by 20 examples. 20 examples I will give you one by one, what is involved in it, and examples of it. All right? Mental and emotional health. Let us pray. God and Father, be with us in this session. Let your Holy Spirit teach us and guide us and make us more aware of what we need to know. In Jesus' precious name. Amen. All right, neurotic behavior and neuroticism. What does it involve? Of course, it involves the brain. Now, I start off with a very important quotation from the book Ministry of Healing. Listen to this. The relation that exists between the mind and the body is very intimate. When one is affected, the other sympathizes. The condition of the mind affects the health to a far greater degree than many realize. Many of the diseases from which men suffer are the result of mental depression. Many of the diseases, that's physical diseases. Grief, anxiety, hope we'll come to anxiety, because a lot of people suffer from anxiety and they don't know. And don't mind that they may not be sad, may be smiling. Even depression, that's right there as well, depression. Because there's something called smiling depression. And even though the person may be smiling, they are still depressed. So grief, anxiety, discontent, remorse, guilt, distrust, all tend to break down the life forces and to invite decay and death. Ministry of Healing 241, paragraph 1. A very, very important quote. Neurotic people may find themselves overthinking, over-worrying, unable to let things go, or preoccupied with their health, their job, or the opinions of their friends and loved ones. Now that sounds normal. Every one of us has quirks, curious ways of thinking or behaving, but neurotic tendencies interfere with work, relationships, and your overall state of mind. I meet a lot of these people. You're neurotic is often used as an insult, but it's actually a mental health descriptor. Having a neurotic personality is not easy, but there's plenty of hope. There are ways to manage neurotic personality traits. And one of the most important is seeing a therapist to gain emotional insight. Now, the therapist is going to ask some strategic questions to elicit a certain response from you. He's going to ask you if he's using, for example, CBT, cognitive behavioral therapy. He's going to use questioning, talk therapy, and so on, to get you to examine your value system and how you see it, and your actions, and the fact that they're impacting negatively on others. So seeing a therapist is very good for emotional insight. Now, I was involved in some psychotherapy at the psychiatric hospital. Not, as I say, I always have to clear, not as a patient, but more as a psychotherapist. They asked me to manage 2 psychotherapy groups, one with the manic depressive, which is bipolar, and the other one with the schizophrenic. And the purpose of it was to help to give them insight concerning the nature of the illness, treatment, importance of staying medication, and rehabilitation. And then I had to write out kind of thesis on that, my whole experience there, and then my recommendation. My problem was nutrition was not well enough, and there was no exercise program, and all of those I recommended. Everybody asked for a copy. Now, the whole purpose is to help the person manage on their own. But what does it mean to have neuroses? That's the question, a very important question. Neuroticism is no longer a diagnosis. It is a descriptor used from parts of many different disorders, including depressive or anxiety disorders. And neurotic behavior can indicate bigger issues. Now, the reason why I entitled this neurotic behavior, because neurotic behavior and neuroticism, is because you may exhibit neurotic behavior, but you may not be a neurotic. Very important to understand that difference. Because a person can have obsessive compulsive disorder. A person may manifest obsessive compulsive disorder, but a person may behave, in an obsessive compulsive way, but they may not have obsessive compulsive disorder. The problem with the disorder is that it takes control of the person, and the person is no longer in charge of themselves. So you're dealing with neurotic behavior, which can indicate bigger issues. Some examples of neurotic behavior include obsessing over what others think, or having a more anxious temperament than others. I want you to help diagnose yourself, right? Someone who struggles with neuroses may have difficulty when they make mistakes. At school or at work, they might be overly critical of themselves and others as well. Listen to this one. Did I do something wrong? Is everything okay? That's one of the questions they ask. A hallmark sign of a neurotic personality is chronic worrying. And when they don't have anything to worry about, like one person I know, they worry about not worrying. So that's chronic worrying. Worrying can be a sign of anxiety, but it also indicates neuroses. A neurotic person has anxiety about their behavior and how others see them. Get that? How others see them. They are fearful that others dislike them, so they might ask for reassurance a lot. All right. It can be distressing to those around them when they are constantly asking, did I do something wrong? Is everything okay? It's normal to worry, but when your work or relationships suffer from worry, it can be a sign of the negative impacts of neuroticism. It can be distressing for those around them when they are constantly asking, did I do something wrong? All right, I just read it. Now, neuroticism has a positivity in it, a positive in it. The positivity behind neuroticism, listen to it. Research tells us that neurotic people are also highly sensitive and empathetic. Sensitive. They can pick up people very well, and empathetic means they can see from others' perspective that they are hurt or something of that nature. Empathetic. They might be vulnerable to anxiety and depression. I'll deal with depression another time, a whole set on depression. Because there are a lot of people, including adolescents, that suffer from depression. And a lot of teachers don't know it. And then wonder why the children behaving like that. But some adolescents suffer from depression. And especially was this so during the COVID-19 period, when there many were at home bored, they couldn't go out, and so on. So they might be vulnerable to the anxiety and depression, but they also exhibit more emotional depth, easily picking up on their friends' feelings and wanting to help. That's the positive there of neuroticism. And being anxious or neurotic doesn't make you bad. It is a way of operating. It's just how they operate. But as I said, it's one of the signs of other anxiety problems. You tend to have a stronger reaction to things and worry about the feelings of others, and you want to help them feel better. From one perspective, this sensitivity and emotional depth is a positive trait. And it shows that even if you are the neurotic one in your friends group, that doesn't have to be a bad thing. Now, for example, there are some children or some adults who have autism, and some are geniuses, some autistic person who are the autistic spectrum, because it's a spectrum now, autism spectrum disorder, starting from ADHD all the way up. Some are high functioning, and some are at the low end of the spectrum. And you may not be able to pick up some of the behavior. I remember meeting a lady in New York. My wife knew the person, and she had a child. And all I did to get that child's attention, the child was looking away, ignoring. I had difficulty expressing themselves. I said, sis, I think you should go and have your son examined, because I think that this child may very well be autistic. She took my advice and she went to a doctor, and they told her that her child is autistic. They put her on the system, then they provided all kinds of support. That includes food stamps and location and housing, everything the Americans do for autistic children. Then a bus to pick them up, to carry them to the autistic center. All kinds of things the Americans do. But they never knew. And the doctors picked it up when the child got there. So being able to identify even neurotic behavior is going to be helpful to us when we are dealing with people. I just mentioned here, they tend to have a stronger reaction to things. A stronger reaction to things. And they worry about the feelings of others, and you want to help them feel better. From one perspective, this sensitivity and emotional depth, as I just said, is a positive trait. And it shows that even if you are the neurotic one in your friends group, that doesn't have to be a bad thing. All right. Neurotic behavior. Many people do not recognize their own neurotic personality or behaviors. Furthermore, each person may have a particular neurosis, but some people behave more neurotically than others. Being neurotic is best defined by behavior. It can be harmless when mild, but dangerous when intense. All right, one of the things they have to deal with later on is borderline personality disorders. You have a lot of people walking around with all kinds of disorders. Sometimes we can't spot until something happens. Now, I remember I was driving from Carlton to, from the highway up by Brighton Road to Carlton, and I was trying to get away from a lady who was driving coming down. And as close as I went to the wall, she still knocked off my mirror. And a lady nearby who saw started to behave so bad. She blamed me, even though I couldn't get away anymore. And I tried to show them that I was close to the wall here. And then she got became very hysterical and calling on me and telling me I was wrong. I was with my brother at the time. And then when the police came, she told the police that the other lady almost nicked her down, meaning the car was on her side. And that was the argument I used with the policeman. You see what I told you? The car was right on her side, close to that. I was next to the wall, and she thought I was trying to use psychology to the policeman. Anyhow, you got to deal with people. It ain't easy. And one of the things that will show you on here now is road rage is one of them. All right. A few examples can be harmless when mild, but others can be dangerous. Here are some examples of neurotic behavior. Maybe you exhibit some of these behaviors and you didn't even know it. But don't sweat it. After all, recognizing a problem is the first step toward problem solving. I met someone the other day, and I found that they were very, very hyper. And then somebody came along and said they became very, very depressed. And then they got a little encouragement, became hyper again. So they were swinging between manic and depression. And that's bipolar, we call it. Some people don't even recognize that they're bipolar. A man like Einstein and some of these people like Mozart and others were highly bipolar people. But they function at a good capacity. Anyhow, you're going to look at a few examples. Examples of neurotic behavior. Number one, consistently feeling irritable. The proverbial crabby neighbor. If a neighbor is crabby, people say that that person fits that description. The proverbial crabby neighbor is displaying neurotic behavior when they routinely complain about minor issues. Hear what I just said? They routinely complain about minor issues. When they're constantly nagging you to be quiet, to stay away from their property line, or to keep your kids off their sidewalk, they may be showing you their neurotic personality. Complaining about physical symptoms without a medical reason. Physical symptom without a medical reason. Plenty of neurotic behavior comes in the form of mysterious complaint about physical symptoms that have no medical cause. And when someone with no diagnosable illness talks a lot about their bodily symptoms without having an actual medical condition, they annoy others. Although they can't change their anxiety-prone personality, their relationships may suffer from their neuroticism. Another one like that is something called factitious disorder. When people make up things that they're feeling and symptoms and so on just to see the doctor. But nothing is wrong with them mentally, physically, that is. Factitious disorder. Number 3 is road rage. You ever had a situation like that? Yeah. I told you about me and the ZR driver at the gas station. When I was coming around and he waiting to get out, the car broke down. That was another car that I had. And I tried to start the car and the man, you know what we do now? Get up now. Imagine that. And I start the car again, trying to move it away from him, and it got back down again. So he was about to get out to pelt some blows at me. I don't know. Some people say, you don't have to beat him, you know. You can just use something to disarm him and hold him there until the police comes. But sometimes at my age, you know, I can't think about that. I think about getting away from that. So people with road rage are displaying neurotic behavior. Every little thing, you ever drive with somebody, every little thing that happens on the road, they're commenting on and getting upset and angry. After all, people make mistakes while driving, am I right? People make mistakes. I get a lot of that. My wife is always on me if I could barely make a little mistake. And I tell her, why don't you go and get license and drive the car? Some of them end in wrecks, but more often than not, they correct themselves and get back to driving well enough. Over the top anger, some people blow their top and they get out and they get something to damage somebody else's car. That's why some people travel with guns in the car, so that if somebody get out, I saw a person got so angry, they got up with something to go and lick in the other person, and the person just showed them the gun that they had. And the person said, all right, sorry, I went back to their car quietly. It's how controlled people can be when they see a gun. Now, some Christians believe you should travel with a gun. Others say the Lord will protect you. All right. So over the top anger at minor mistakes is a clear sign of a neurotic personality type. Number 4, constant anxiety about your children's safety and health. Parental neuroses over the common risks children take can result in a helicopter parenting. Though they may be well-intentioned, these parents do not create the conditions for a normal childhood. You know any parents like that? They're always quarreling and fretting and nagging with their children, constantly on them. Those children can grow up to become neurotic. The parent neuroticism creates anxiety and negative emotions in their own children, resulting in miserable, worried, and self-conscious children. So yes, parents can enhance or cause children to develop that trait. Just as the textbook said, conflict between parents in the home can lead a child to become a lifelong schizophrenic. Lifelong. Number 5, being overly aware of psychological symptoms. Ironically, people can know full well that they are displaying neurotic symptoms, but they will behave that way anyway. Being obsessed with potential mental illnesses can make their problems even worse. Of course, if you are troubled by serious symptoms or anxiety disorder, you have to deal with that one sometime. Anxiety disorder, it's important to seek help. Even then, you don't have to analyze yourself at every turn. Number 6, feeling distress over everyday events. Feeling distress over everyday events. It's perfectly normal to be upset when bad things happen. That's perfectly normal when bad things happen. But it's unreasonable to become consumed with negative emotions over something minor. What did I just say? when people become consumed over something minor. That's not a good sign. Breaking a fingernail, spilling your breakfast cereal, or being 10 minutes late to meet a friend are all examples of common problems. There's no need for something minor to ruin your day. Feeling distress over everyday events. So that's an important aspect. Next one is obsessive thinking and or rumination. Obsessive thinking is not only neurotic behavior, but it can also lead to psychological disorders like depression. When you often ruminate about things you should have done differently or about minor problems in your life, other types of neurotic behavior, depressive disorders, and mood disorders can follow. And there are a variety of mood disorders. Perfectionism. Most people want to do well in whatever they do. There's a difference between that and feeling you must do everything perfectly. People who are perfectionists usually spend more time than necessary completing tasks because they're determined to avoid making a mistake, and this veers on the edge. This veers on the edge of anxiety disorders. Number 10, dependency. Being too dependent on others to meet your daily needs can cause a variety of neurotic behaviors and negative personality traits. For example, rather than doing something for yourself, you whine about your problems, hoping someone else will solve them. That's another example. And you wait for others to do things for you when you could be taking care of your own needs. You become clingy and at the same time irresponsible. Number 11, trouble getting along at work. Some people have trouble getting along at work. So I ask those kind of questions. How do you get along at work? But that person has constant conflict. They have no friends. They're always in conflict with somebody. You ever meet some people like that? Always in conflict with somebody. Then we come to the borderline personality type, you see what I mean, and the histrionic type personality, always getting in conflict. Some little minor thing is blown out of proportion. People with neurotic personalities typically have trouble getting along with others at work. Social neurotic behavior, like being needy, whiny, dependent, or argumentative, can take a toll on your business relationship and keep you from succeeding at work. And people remember you. They have a stamp of your behavior at work. Then there's difficulty taking care of basic needs. Neuroticism can even keep you from taking care of your basic needs, which can also indicate mental illness. Mental people don't really take care of themselves. And one of the things we use at school to tell when children are neurotic or even upset regularly is the smelling them. There's something known as the smelly child. And then you look at how they are dressed, if they're well kept, all of that. Because usually when people are neurotic and of that kind of nature, they give off a certain odor. Because they don't usually take care of themselves, and the odor mixed with the unclean clothing produces a certain smell that we call it the smelly child. So if you feel unwarranted sadness, that is sadness for no apparent reason, anxiousness, or other negative feelings, you may find it difficult to complete routine personal care tasks while bathing and grooming. That is why people with certain mental illnesses don't live long. Well, we probably have the longest one in Barbados who just died. You know that person? Just died. All right. Ninja man. Some people didn't know that. And people say he was a very intelligent man. It is amazing how people will say things after people die that had mental problems and other. And nobody looks at a person who's living and intelligent and say, well, he's a very intelligent man. But they say that with people who have mental challenges. All right, so you may also have trouble sticking to a healthy eating plan or getting enough sleep because every little disturbance gives you anxiety and makes you feel overwhelmed. And that is why people sometimes with mental health problems stay up all till 3 o'clock in the morning and call numbers that they seek through which to get help. Can you imagine that? All right.
Brother Saul,
That's number 12.
you got a lot more to go after this.
We got a 20, 13 or 7 more.
Well, I missed 7, 8, and 9. I just want to take a picture of them, please.
You want to ask a question or one?
No, I want to take a picture of the slide, but you went through them so fast
okay.
that I missed 7, 8, and 9.
I can send it to you, you know.
All right, do that then.
Number 3 is relationship problem. Now, whether in marriage or otherwise, people, can you be married, imagine being married to a neurotic person? And one who constantly nags, blows things that are small into mountains out of molehill. And some people wish they can turn back the clock. But it's not easy to turn back the clock. It's not easy to turn back the clock. Miserable, fretful, irritable. Every little thing makes them annoyed. Can you imagine that? And they feel that they are doing it to somebody when in fact they are making their condition worse. I was in a bus one time years ago, and I saw a lady behave so bad to a child. That's a big woman, and she got on so hyper and so miserable and fretful over a misdemeanor of a child. All right. So relationship problems are common for people who behave in neurotic ways. They might nag, whine, and expect their partner to do things they could do for themselves. They may also struggle with self-doubt, self-esteem, and other personality or mental health issues. Now, some people I know don't like the word self being used, but the Spirit of Prophecy in the book called Mind, Character, and Personality talked about self-development and self-worth and a few other things like that. So we need to put things in the right context. Don't just call everything self. A person who lacks self-development is a person who doesn't know how to handle certain things in life. So relationship problems are very common for people who believe in neurotic ways. They may also struggle with self-doubt, low self-esteem, and other personality or mental health issues. If you've ever done any studies on on what we call personality assessment and theory, you may be able to assess many people's personality. Misdiagnosed too. Well, it's not our job to diagnose a client. That's a doctor's job. Nor to give treatment. At least medication, that is. They may try to control their partner, or they may accuse them of being unfaithful without any evidence of cheating. That's not a good sign. Being a drama queen. You heard the term drama queen? The term drama queen is very popular, especially on social media. A drama queen can be anyone, male or female, who seem easily disturbed and stirs up controversy among their friends or make a big show of emotion about minor incidents. Minor incident. When you make everything a big dramatic production, you not only make yourself miserable, but you also put others in the same situation, disrupting their ability to have a peaceful day. Drama. Number 15, excessive sadness over minor events. Excessive sadness over minor events. There's nothing mentally unhealthy about being sad over a major loss. And people react differently. Just this week, as I said, I went to a corporation to do counseling, grief and bereavement counseling. And I had 2 individuals from one place and then 35 online. And of the 2, one, a big chap came in, sat down, they gave me an office to use. And he came in, and I looked at him, I introduced myself, and I paused a minute. I said, it's difficult to lose a loved one. And he started to break down and crying. Big strapping man. And then he cried again. Then he cried and sobbed another time. And then he cried again. Very emotional. He lost his parents as well. But, you know, the memories of the past come back to you again. And then after he left after an hour, they sent in another chap who was recently at the bank, but he came from the Bahamas. And he was pretty strong. The interesting thing is he lost his mother 3 years ago. He lost his father before that. But he never cried for any of them. He's not the crying type. I have something on that too. What crying does. And interestingly, he almost came to a point of eyes welling up with water. But then he brushed it off. And he says, I must say that this is helping a lot. That is how he puts it. But some people don't cry. And they believe that you got to be strong and not cry. But strong people cry. But you may not cry at the same time because there's something called delayed grief and anticipatory grief. I've had cases to deal with those. Delayed grief. For me, I went to New York. I witnessed my sister's funeral, and she died tragically, you know. And I didn't cry. I was there. I spoke to about 1,000 people at the funeral, at the church. And then they invited me to preach at church. Then I came back home. But then I was giving her Walkman. You remember the days of Walkman? I was giving her Walkman to go home with. And then when I got home, and I was walking through Bridgetown at evening time, listening to the Walkman, I broke down crying. Delayed grief. And then there's anticipatory grief, meaning if you expect a loved one to die soon, you can grieve. And I had a young man like that who was in my class, normally well behaved, but he started to give trouble. This is when I had seniors at the time, 15, 16. And I sent him next door to sit down in the next classroom and said, I'm coming there now. I assigned my class somewhere. I went next door. When I started talking with him, he broke down crying. And he told me his father is dying in hospital of prostate cancer and there's nothing he can do about it. And they were very close. Father isn't dead yet. Anticipatory grief. But grief can be very complicated. Everybody grieves differently. And I'm finishing off my booklet on that. Because some people like to say, God understands. God takes the ones he loved the most. Those are not helpful words at all.
Correct.
One man told another family that was grieving a relative that was shot to death. He dead already. It doesn't make any sense crying. So I delayed it because I wanted to put in words to say and words not to say when you're seeking to comfort people. And don't tell them you understand. They will look at you and say, you don't understand. All right. So let me go to excessive sadness over a minor event. There's nothing mentally unhealthy about being sad over a major loss. However, sadness, crying, or staying in bed over small setbacks can indicate neurotic behavior. Maybe you lost the pen you used to sign the mortgage on your first house, and that pen meant a lot to you. I had just gone to Trinidad. I came from Canada and went straight to Trinidad. New brand AF54 phone. New brand. And I got in a taxi. You know the taxi? And the phone slipped out my car into the seat. And I didn't know. And that was the end of that phone. 600 Canadian dollars. You want to tell me I didn't grieve? You grieve when you lose things. You grieve over a pet. Even a pet. I had a case. There was a case of a shooting of a son by mistake at one point, and I had to counsel the son and the classmates. And one son mentioned, one child in there, 11-year-olds I'm talking about, 11-year-old that was shot dead by mistake. And when you hear the shout, one child mentioned the loss of a pet that they had, and that caused a lot of grief. So we can develop attachments not just for things, but for animals as well, and then we grieve. And some people take on the burial for money. Like the priest that was asked to bury a dog. And the priest said, me? Bury a dog? No, sister, I can't do that. Well, check with so-and-so. And he said, do you think he would accept $1,000 to do the job? He said, the priest said, that's good dear sister, you didn't tell me that the dog was a Catholic. He can do it now because of the $1,000 he heard that was involved. I tell you. A moment of sadness might come, but when you foster it and let it go until it affects your functioning or temperament, that indicates some level of neuroticism. Number 16, envious behavior. Another one, people who display neuroticism may have feelings of jealousy toward others. You know what Henry Drummond says? Whenever you attempt to do a good task, you will find somebody who can do it as good as you or better than you. Envy them not. I like that. The Scottish reformer who wrote a treatise on love. The greatest of these is love. People who display neuroticism may have feelings of jealousy toward others. You want to have the possessions that others have. You want to have their opportunities or advantages. You want to be them. You may have obsessive thoughts about what they have that you don't. You may express these desires with neurotic behavior like sabotaging, begging others to give you what they have, or even stealing. You know, sometimes we don't like people for no apparent reason. The Bible says they hated Jesus without cause. There are some people who just look at others and just don't like them. Guidance counselors had a big topic with a man who said, there's some people you just don't like. He said, but if you are a church and God, you don't have people you don't like. He said, I'm not saying I don't love them. I don't like them. Was he right or wrong? Feelings of not liking versus loving people. You don't ever wake up every morning saying that you love your wife. You may not like how she may nag you. All right. Number 17, reacting negatively to neutral events. Notice I said neutral events. Sometimes the event that upsets you is neutral, but you react in a habitual negative spin on the event. For instance, your mail carrier might place a package on your doorstep rather than knocking first to get your attention. You know, in America, people like to go on people's doorstep and take up the parcel that was put there. Somebody invented something with some dye to explode. The moment you pick it up and you say, you count to 5, 1, 2, 3, it explodes. And the person gets all blue with dye or red. And the person says, I'm not going to take this anymore. But they had no right to go and take up the person's stuff. Some people come up with strategies to deal with people without killing them, but making sure that they feel it. All right. For instance, I mentioned that if you get upset anyway, even though you heard the carrier, saw the carrier, and received the package without a hiccup, then this is a clear sign of neurotic tendency. Number 18, panicking in relatively non-threatening situation. You ever see somebody doing that? Panicking in a non-threatening situation? It is natural to panic in threatening situation. It's part of your ingrained flight or flight mechanism or response. However, if panic attacks happen when nothing is threatening in your environment, neuroticism could be prompting your unnecessary panic. And when people get panic attack, their palm sweat, their chest become tight, and they're breathing quicker. Panic attacks, or what we call anxiety attack. However, it is important to rule out mental disorders like anxiety or panic disorders before blaming this personality trait on neuroticism. And you know, the psychiatrist diagnosed that the person has a mental disorder. It is either 6 out of 9 or 3 out of 5 symptoms. So it may not always be the accurate. And then they tell them to try this or try that. And then one produces more palpitations of the heart. And then that may be too strong. They lower the dosage. Or they may take the person off of that one and give them another. Anyhow. Number 19, displaying emotional instability. That's another one. Because you are not so easily thrown off, because you're so easily thrown off balance by even the smallest events and circumstances, you behave in unstable ways and demonstrate emotional volatility. You may seem to be doing fine 1 minute and then get angry the next. This might be followed by sadness a few minutes later. No one can count on you, and all of your relationships suffer. That's another one, emotional instability. When people are dealing with you, it's like walking on eggshells. They don't know when you're going to break or explode. Again, I had people to deal with like that. Not easy. Not easy. And the last one, inability to function in everyday life after an unrelated trauma. Notice that, an unrelated trauma. Post-traumatic stress disorder could be considered a type of neurotic behavior. Because when people get involved in wars or have a traumatic experience or that kind of thing, it affects how they function mentally. And traumatic stress disorder can last for acute, that is, for a few weeks or years. Traumatic, post-traumatic stress disorder. That can be considered a type of neurotic behavior. You may have had terrifying experiences in a war, but if the sound of fireworks going off triggers a relapse, then you have experienced a neurotic episode. Sometimes it takes something that is unrelated trauma. I don't know if you ever dealt with a person who felt that they can sleep at night when the light turned off because somebody was under the bed. And you came and you turned off the light and you showed nobody's under the bed. But they still feel so. So you know what the therapist did? The therapist took off the legs off of the bed and put it flat on the ground and said, so we got rid of the terror now. And the person slept comfortably after that. Can you imagine that? Small things like these. And then I haven't even gone to things like phobias yet. Phobias that people suffer from. And the different names of them. And how to deal with phobias. You know you can deal with phobias. You don't have to go through life forever fearing a cockroach or a rat. And there are different treatments that can be used, like virtual treatments and others. Anyhow, let's close off. Yeah, so you may have had a terrifying experience in a war, and if the sound of fireworks going off triggers a relapse, then you have experienced a neurotic episode. Similarly, you may have been abused by a parent. That's another one now. I've had a lot of those. You have been abused by a parent when you were a child, and if you feel scared when you are alone around another adult, that can be a sign of neurotic behavior. I left out one slide. All right, some ways to stop your neurotic behavior include building your self-esteem or dealing with somebody who knows how to help you stop. Every year we have a section in the winner's circle dealing with self-esteem. And the children look forward to that one. I do all of those over a 6-week period. 2 sessions a day. Over a 6-week period. And the children remember that. And even when they see them at their school, when they go, they still remember. How dealing with self-esteem is important. Making an effort to do things for yourself. Having clear responsibilities. Learning to stay calm in everyday situation. Learning to be satisfied with what you have. Taking good care of yourself even when you don't feel like it. Reminding yourself that it is not worth getting upset over minor negative events. Neurotic behaviors are difficult to change by yourself, and you may need to get help to overcome them. This is especially important because, according to a 2002 study, people who engage in neurotic behavior are more likely to develop psychotic symptoms. What is meant by psychotic symptoms? They begin to hallucinate. They have delusion, the referential and paranoia and others. Their social apathy, they will become withdrawn, not speaking to people or doing activities they like to do. They see things that are not there. They hear voices. All of those. They call it, they have different names to these hallucinations, visual, auditory, and others. So it's important to get treated, even if you are neurotic. And first thing to do is to be willing to help, receive help. Treatment for neurotic behaviors might include anything from medication, that is provided the right medication is reached, to cognitive behavioral therapy, we call it CBT, when you challenge the person in their belief system and their value system. Behavior therapy that includes instruction and reinforcement has been shown to change neurotic behaviors as well. You can talk to a licensed counselor for help with neurotic behavior and other mental health issues as well. All right, I'll stop. Let's stop there. All right, so.
Back to that slide, please.
Sorry.
This is the last one.
All right, I have to come forward and then.
Like, give me 7 days and 9 days. But don't do far.
I will have to go, well, as I said, I'll start from the beginning and then come down.
All right.
All right, so that covers neuroticism. We didn't cover everything, but that's just one section dealing with example. And I'm giving you examples that showed you how you can identify neurotic behavior. Can Christians be neurotic? Good question, right? Can Christians die from AIDS? Can a Christian die in a plane crash? Some people like to say no to these things. But the Bible says time and chance happeneth to them all. Can a Christian be raped? Yes, that's the means of Satan persecuting. I had a sister who was raped, stabbed to death, made jugular vein cut. And she was a really, really nice Christian. A nurse taking care of elderly patients, and the one who was very considerate of others. So that if a person came to her church and they felt withdrawn or not belonging, she would go and befriend them and bring them to the group. And they attacked her in the early morning when she was going to work between the two glass doors in the apartments in New York. Took her up the stairs and she tried struggling with them, and they cut her main jugular vein to prevent her from screaming. And there were 2 steps more to get to the roof. So they wanted to kill her at the roof, on the rooftop. I was over there the next day. I was doing my teaching practice. I spoke to my tutor, Bert Thompson, at the time, a psychologist. And he said, no problem, I already have a grade for you. You can go. I booked a flight. That happened Thursday. I booked a flight early in the morning. I didn't have any money at all. And then my cousin called me and said, somebody should go up. I said, well, I'm available. So no problem, we'll give you the ticket. Meet me in town. I went to American Airlines, bought the ticket, explained the situation, and within the next 4 or 5 hours, I was up there. And the first time I ever felt snow, I felt I was going in a freezer. It's a good thing my brother had a jacket for me. I never knew that a place could be so cold. Anyhow, all of those are experiences that we have, and if we don't know how to cope with them, they can get worse. All right? All right, I'm just going to open for any comments that you may have or any questions once I'm in a position to answer them.
Good afternoon. Sir, would you acknowledge that children are the product of the parents' teaching? Would you acknowledge that?
Look at that, children.
Children inevitably are the product of what the parent teaches them.
Yes.
Good. But right now I'm teaching PE at school. Just to run an example. And when I first started PE, we had PE teachers who were like giving to every whim and fancy of the children. If they want 5 breaks for water, they get 5 breaks. If they fall together, scratch, they gotta go and carry them to the sick bay and tend to the car and such like, and dress it up and play fancy. But along comes Mr. Codring then. And I don't believe in any of that. Right now it's paying dividends because we have a lot tougher children now, but you will find some adults who will say, you're too rough on the children. Now, when I used to take my children running, right now I have reception children running 4 laps around the school, not the pasture. The pasture to me too small. But you will find some teachers who will say, you got the children running like horses. And then when they fall down and get cut and they come to me crying, I will listen to their cries and examine the children and realize most of the children don't even have a bruise.
What age group you're looking at?
Between 4 and 8.
Okay.
All right? Now, I remember one day, we have a lot of dunk trees on the pasture. And one day there was a piece that was dry, and it was hanging down as the children passed, and they could get hit with it every time they passed and such. So I decided I was going to pull it down. And in pulling it down, I wasn't getting it pulled, and some children offered to help me. They say you can get stick. The other game teacher's looking on. And I said, Mother, let me pull it down together, but don't get stick here. That was just stalked already. And they held on to the branch and let me pull it down, and it came down. Now when it hit the ground, a child who wasn't involved in the pulling down was standing there, got a little stick and start crying out a whole loud bunch of noise. And I look at each other and say, it's just a little stick from it. Just go and wash out the pipe and go and play. You're okay. You know, the teacher may complain and say that Mr. Cardinal pulled down the branch, stick the child, and how he can cause a big bundle thing at the school, and how the parent got to get called in. And I just looked at this and said, we raising some very soft children, a little stick you got to call in these parents to write report for a stick. I remember one day we had some children running. The children were running laps coming around the pasture, and one child ran into the next one's head. 2 teeth came out, just running. All they want to be in charge, all they want to be in front, and they were just running and enjoying themselves, and a collision occurred, and teeth fell out. But I took up my teeth, gave them to the child. The teeth were already shaky, you know, because these are young children who are about to lose their teeth at 5, 6, and 7, some of them, or 6 and 7, I should say. And I gave each child the teeth to carry home. And a parent came down to the school and said the school got to pay to get her teeth put back in. Now I said to the parent, mistress, you're talking foolish. Because the child is at the age where they're about to lose the milk teeth. The child herself said that the teeth were shaky, but she wants the school to be accountable for the 2 teeth coming out a little earlier than anticipated, which would have been later on in the week. You know? And I said to myself that we have some parents nowadays, because we have a lot of young parents who are very dramatic, and they're trying to make life difficult for teachers at school. But then again, we have some teachers who give in to this dramatic behavior by the parents, because they are so afraid of what they call losing their job or losing their little pick, that they're almost siding with the parents. But I don't do that. That's the truth. That's me. But what I'm saying that this neuroticism that you're talking about, I see a lot of it in schools, right? A simple little scratch. You got to go and raise a big report on a scratch, as if the child is not supposed to fall. I remember a child was transferred from my school because the child ran into a door, and the child came home bruised. How did the child get bruised? The child was running and trying to play with the games with another child and ran into the door and got a bruise. And the parents want to know, where was the teacher when this occurred? She wants a report done. We got some crazy people in Barbados, you know? And we even got some in church too, who believe in this sort of behavior. That nothing should go around their child. In my reading on the book of the Israelite journey, the Sovereign Lord says, many parents weigh down themselves with burdens, as if God, if you don't, as if they feel that God doesn't care about their child, and the care of their child is up to them. But God is telling us that all this neuroticism you're talking about is basically self-exposed in different forms. And I don't buy into it that much. I listen to your slides and things and find them very interesting. This is an area you would have studied. But I just see it as a manifestation of self that needs to be kept under by the Holy Spirit in many areas. There are some people who can't get it done, so they need external help by yourself and other competent persons. But I would say Jesus was the greatest psychologist that ever lived. You would agree with that, right?
Yeah.
But he also said that the problem with everything that encompasses us is the problem of sin. And until we get sin not under control, eradicated, we will always see these behaviors manifesting themselves in one way or another. They may be controlled by you guys who are psychologists and psychiatrists, implementing various man-made methods to control or mediate a symptom. But to properly eradicate it, you need the saving grace of God.
All right, thank you. There are a lot of major experiences. I've had some by just observing people in New York, when I was observing the Hispanics and the children who were playing in the park, and the Caucasians who were observing their children. When the children fell, the parents came to them, or rushed on some blacks as well, and started to comfort and started crying. But when the Spanish observe their children fall, they say, get up and go again in Spanish. That's your hand, go. And they get up and they're gone again. And I mean, it's how you react sometimes that determines how the person processes it. Yes, you are the man.
Hi, good evening.
Good afternoon.
I wanted to kind of keep my quiet, but I have been pushed to respond to what I heard here just now. By the way, your presentation is excellent, it's relevant, and we are in a society, of course, not only in the world, but in the church where we are faced with such behavior. But what gets me is when persons try to spiritualize this reality. When they all bring it down to the fact that it's a sin problem, it is self, it is whatever. That is so disturbing for persons who have intellect that would not only summarize that kind of distraction after all that you've presented and to say, you know what, it is just a self thing. It is about sin and the problem of sin. I mean, what is it that you're saying when you give that kind of response to therapy that is available and it can be used and can help individuals come out of these situations that you're in? That's my concern. Why do we often respond as a church that all of these issues can just be prayed away? And we just stick the blame on the devil and on sin and everything else. Why? Maybe you can respond to that.
It's the easiest thing for people to do that. Some people don't believe that some of these things can be treated. That some of them have a past history, a past barren parenting, and so on. And I know there are some Christians who are talking about praying it away, casting out the demon, all of these things. But I believe that Ellen Whitetail says, if you can go to a well-trained Christian physician or a well-trained Christian counselor or therapist, you can also, that is also another way how God can heal and restore the person. So this thing is fanatical. This thing is fanatical about having to pray it away. I have people who believe that they can pray and cast out all the demons in the room, calling them by name. And some people feel that they can do that with the whole island. You know what I mean? That kind of thing I am wary of. So I believe that we are here to help one another, and God has put talents and skills in the church in different ways, and that we should all cooperate with each other and just help. Now, I was asked a question one time by the Nation newspaper when the Minister of Education, Ronald Jones, said that there are some children in schools that are mad. They have some serious psychiatric problems. And they asked me, what's your take on that? You know the news. What's your take on that, Mr. Leacock? And I would simply say, unless Mr. Minister is a psychiatrist or a counselor or he can't identify those children. And so he's making a statement of what he believes is a possibility. And that's not his area of training. So he's making a statement of what I call a generalization. But we have to deal with them. Those who have to deal with them know that when there are some children that come to them that ask for the door to be shut, to something to put at the bottom so that nobody from outside can hear, to close all the windows, and then tell me that they see black men in long gowns and red eyes, or that they hear voices at night. I know that they have some serious problem. I know. And it's not just a matter of praying for the demon to come out. And all psychiatric problems are not demon possession. You understand what I just said? Some psychiatric problems can be caused simply because of nutritional deficiency. A nutritional deficiency in B12, B1, B2, B3, B6, which is more the vitamins for the mental state. can cause people to experience some serious mental disorder. And as I recommend my book again, Psychodietetics, written by the leading nutritionist in America, it was very insightful that it is not all mental, it is not all demonic. And when you treat the illness with some good nutrition, you see a response, and they're able to cope better.
Right, I agree with you on that point. Is there provision made in your field for seeing if nutrition is responsible, poor nutrition is responsible for some of the maniac behaviors that go on with people? Is provision made? Because I know, I'm not even talking about madness now. Let's say, for instance, the other illnesses, doctors in general, besides Dr. Duggan and one or two others, do not make provision for food to be used to cure or help or treat a particular situation. They usually go straight to medication. Is there provision made for people who have psychological issues to see if nutrition is a part or plays a large part in the way that they are acting? The reason why I say that, you remember the situation we just had here in Barbados, just down here in KFL, where this guy came out, sliced a man throat, beat the other one to death with a shovel and such. And people just turned away and went into their houses. What would you have done were you there on the scene?
I run my private practice called Impact Family Counseling Services. I receive people by appointment or by referral, personally. In the education system, there are certain psychologists and network services that they're called to deal with certain children. But I personally have referred some students from me that may be having problems to other places. And you know what happened? The people send back the child to me, tell me, Mr. Leacock, you can handle that. What you send the child to me for? I send the child because I need, if I get too many people coming, I can't do everything. But there are facilities in place. There are facilities in place when people are experiencing severe problems mentally and challenging.
All right, I just wanted to answer the question. Is there provision being made beside medical
You're talking about the
intervention?
nutrition part.
Yes.
The health. The polyclinic supposed to come in to do education when it comes to nutrition.
They don't.
Polyclinic. But other than that, there's the Heart and Stroke Foundation, and that there are others that they deal with.
Well, from what I've seen, from observation, mainly say observation, I don't see nowhere nutrition is ever called upon as a reason for one of these many of these behaviors. I had a friend years ago, and they would go by them, and I would spend time there, and I would see her uncle coming by. Let me just draw this example. And he would always be on camp, so I saw many of the signs in what you presented today. Always had an awful smell, and he would come daily and collect food from the house. And she didn't want to have anything to do with him. And I welcomed him because, well, I want to be in the house with her, so I welcomed him. And I befriended him, I would talk with him. But whenever he went off, people would say that he was not on his medication. I remember one day he came to the house, ripped off the doors off the hinge, threw rocks through the house, and came in to attack her. But he walked right past me and just nodded his head and kept going in the house. Now, I realized one thing I told her about it is that every time he came there, she would say, you're musty, you're dirty, don't come in here, you want a bath, blah, blah, blah. And she was always saying something negative towards him. Well, me, on the other hand, I was saying what we would call positive reinforcement things to him, right? And speaking to him nicely. And I get to realize that as mad as a person is, madmen got the common sense. Or they know what they're doing, most of them. And when he went off and his eyes were fire red, he did damages to their house and to houses in the environs of where he was. But he never touched me. And what the funny thing I noticed too is that when the police came on the scene with guns, all the madness like it ran away. As mad as he was, and he saw a gun, he became sane. So tell me what you saw there.
Yeah, we have all types of problems in schools, and teachers are not trained how to deal with it. And no natural remedy, no treatment, but we just send them to the doctor or something like it. I remember, just closing, I remember almost every day, there was a child that used to get epileptic fits. And he had seen the specialists and others constantly. And the parent brought him to see me. No, I'm no medical doctor. So I started asking questions about nutrition. What does he eat regularly? And then the mother said, he likes a lot of sweet things. He eats a lot of sugary foods and this. I said, well, I'm going to recommend you to go and get tested by a naturopathic doctor. And when the person went and they got checked, the report came back that the child had parasites in the blood. And the parasites in the blood were affecting the brain. And he was recommended to hold off all sugary, sweet products and so on. And she put him on something natural. And after that, the child never had, while we were at the school, never had another epileptic fit again. So there are some natural things that work, and there are some that may not, some practices or treatment that may not work. And up to now, people are still searching, because the area dealing with the mind and its disorders is not an easy field, because the mind works in different ways compared to the body. So anyhow, thank you very much for your listening, our audience. God bless you. Let us pray. God and Father, thank you for another wonderful day. Thank you for the word you've given about knowing the time, and it is time to wake up to understanding the creation of the world and your divine plan and purpose. The children's and the report from Trinidad, as well as this session on mental and emotional health. Continue to educate us and teach us what we need to know that we can help others. We may not be able to treat them or help them, but we can refer them to others to get the necessary help. Guide and direct us. Continue to use us. Continue to use us to bring honor and glory to your name and to advance your cause of health reform. In Jesus' precious name we pray. Amen. Let the words of our mouths and the meditations of our hearts be acceptable in thy sight, O Lord, our strength and our Redeemer. Amen. God bless you. Have a wonderful week in Jesus.